I would consider myself an active guy. In high school, I played basketball and ran cross country and track. And in college, I ran cross country and track for 4 years and got out. And I ended up having some meniscus issues, my medial meniscus. I tore it on my right knee, and I went and had some of it removed. And a couple of years later, my knee started kind of flaring back up again. So I stopped running and started riding my bike more. And everything was going good for a couple of years, and then it started back flaring up again on me. And so I went back to the doctor, and he said that, this is just kind of where you're headed in your life. He said, with all the activity that you do, you've just pounded on your joints so much that basically you're looking at, a few more years, you'll get arthritis, and then we can put a metal knee in, and then that's kind of what you're looking at. And he said that's really the only options for you. I ended up kind of walking away really depressed about that. That's not what I wanted to hear, because being active is something that both my family and I enjoy doing, and it's just part of our life and what we do. I started doing some research, and I found the Stone Clinic website, and what I ended up finding was that Dr. Stone actually has biologic transplants, and so it wouldn't be, in my mind, I'm picturing a little piece of rubber or something like that they put in my knee. And not only did he have a transplant methodology that he used, but it would allow athletes to stay in the sports they want to do. And that's what really spoke to me. When I talked to the therapist before I came back out, they wanted to talk with me over the phone and kind of give me a little heads up about what to expect. I could tell that the recovery was going to be a little more serious than I had anticipated. So my wife and I agreed that we would stay for 7 weeks, and I would come to therapy every single day that it was open, and we came 5 days a week, and I spent an hour here every single day doing therapy with the therapists here that know how to recover from this sort of surgery. I unfortunately had to go back home to my therapist there, and while well-meaning, they just don't have the experience with the type of recovery and surgery that I had. So they're very hesitant about how to approach dealing with me and my recovery, and there were times when they probably weren't maybe pushing me as hard as I would have been pushed had I been here in San Francisco at the Stone Clinic. And the time spent here, those 7 weeks afterwards, were so valuable, and that's a decision that I would definitely do over if I had the chance. Well, I'm here, my 7-month mark since surgery was this week, and I talked with Dr. Stone, and he thought that things were looking real good. My knee joint was very smooth. He checked that out. I did therapy this week every day, and they were real pleased with the things that I could do. And I've started riding bikes, my road bike, both indoors and outdoors again. I was probably taking it a little easy at home because I was a little hesitant about it. And when I came out here, they really showed me that I can push even more than I thought I could. My ultimate goal is to get back to triathlons. So I'm looking forward to attempting running again around the 1-year mark. That's what I've been told. They've given me exercises that are going to strengthen me up to where I'll be able to handle the running motion and the things that come with that. But in the meantime, I'll keep building on my cycling and my swimming and staying active any way that I can.